In this video newsletter, I want to talk to you about a new natural therapy for migraine headaches. So if you're a migraine headache sufferer, or you know someone who is, I want you to pay very close attention. In recent years, we've seen in some journals such as Neurology, Headache, Lancet, the British Journal the British Medical Journal, the International Journal of Clinical and Pharmacological Therapy, and the European Neurology Journal, as well as others, that an herb known as butter burr, when it's been supplemented at a specific dosage and standardized grade, it's been able to reduce the frequency of migraine headaches in people that suffer from migraine headaches by up to 77%. That's really important. Now in Germany, they've used butter burr on a regular basis for more than 20 years for the treatment of migraine. And now the actual research investigations are starting to show up in the actual peer-reviewed scientific journals. So for instance, in 2004 in the journal Neurology, R.B. Lipton and fellow researchers followed 245 patients with migraine headaches who were between the ages of 18 and 65 years old. The results were amazing. Just over a 4-month period, treatment with butter burr showed that these patients, 68% of them in fact, had more than a 50% reduction in the number of migraine attacks they were experiencing. Now what we've seen is that the gold standard dosage, the dosage that actually worked, and this is important because you can't just take any old butter burr, it needs to be 75 milligrams twice daily. The conclusion of the researchers came down to this. They said butter burr extract at 75 milligrams twice a day is more effective than placebo and is well tolerated at preventive therapeutic dosages for migraine headaches. And so again, the gold standard dose is 75 milligrams twice a day. Were there any side effects? The odd person had a mild stomach ache or upset stomach, but that was in very few cases, and that's not really, a significant risk to anybody. So the question is, how does butter burr actually work? Well, there are these active ingredients or constituents in butter burr called peptidins and isopeptidins, which actually block the formation of inflammatory chemicals that get produced in the body when migraine headaches start. These inflammatory chemicals are called leukotrienes and prostaglandins. And butter burr seems to shut them down. It also has antispasmodic effects on the blood vessels that are in the brain, which also can help to reduce the triggering of migraine headaches. And it seems to block the release of histamine, which also can have a nice anti-inflammatory effect. We think the combination of these three effects actually is how it's working. Anyway, all of this is very welcome news for migraine sufferers because drugs that help to reduce the frequency of migraine headache or are used to treat migraine headache, often they have very serious side effects, and so people can't use them on such a regular basis without experiencing some damage to their body. So many migraine sufferers have been seeking for a long time sort of natural therapies that can be useful, that are non-toxic. Some people seek the help of chiropractic, that can help, acupuncture, massage, meditation, relaxation techniques. Dietary modifications can sometimes be useful if there's a food trigger, and also certain nutritional supplements. Now, before we knew about butter burr, we've known for a long time that another herb called feverfew has been useful in reducing the number of migraine attacks as well. So what I did for Adiva Nutritionals is I combined feverfew with butter burr into a single supplement to try to get the maximum effect at reducing migraine headaches. When you put them together, the chances are very good it can reduce the overall frequency of migraine headaches by up to 77% without any significant side effects. And so you can either buy those herbs separately, feverfew and butter burr, or you can get them in a combination product such as Migraine X, which Adiva makes. At any rate, if you're a migraine sufferer, I think this is very important news to try to help you cut down on the number of attacks that you have and reduce the frequency in a way that's natural, non-toxic, and has been shown in clinical studies to be very, very impressive and effective. Thank you so much for watching.